Are you experiencing burning irritation in your esophagus? That might be a classic symptom of acid reflux. My name is Dr. Terranella, and in this video we're going to look at what triggers acid reflux, what some of the common triggers are that I see in my practice, both conventional and non-conventional, and a few ideas on what you can do about it. So if you like this type of information on health and optimizing your health, click on the like button and don't forget to subscribe to the channel to get more videos like this one. All right, let's look at what triggers acid reflux. So what triggers acid reflux? First, we want to look at what is acid reflux. And basically what it is it's a sensation of burning that occurs from the stomach acid irritating the lining of the esophagus. And it does this by regurgitating or refluxing up through the lower esophageal sphincter. So you have your esophagus going down your throat here, and then at the very bottom before it gets to the stomach, that's where the lower esophageal sphincter is, and it's a one-way valve where typically you wouldn't expect things to come back up, but sometimes that is part of the issue. So if that valve opens up, the acid that's in the stomach can get into the esophagus and irritate that lining. Now, the lining of the esophagus is much more delicate and soft tissue as compared to the lining of the stomach. The stomach is much more thicker and tough. Because of the difference in the lining, the stomach is able to tolerate that acidic environment a lot better than the esophagus. So when the esophagus encounters that acid, it creates a lot of pain, burning, and irritation in the esophagus. So when we look at the esophageal lining with a camera, with an endoscopy, you can see that it's irritated. The tissue of the esophagus has become red, inflamed, and sometimes even damaged. The question we want to look at is what's triggering the acid reflux, or what's triggering the acid to actually get into the esophagus. And there are two main things to think about with this: the integrity of the lower esophageal sphincter, the sphincter that prevents the acid from coming back up, and also the total amount of acid that's being produced. So stomach acid is produced by specific cells in the stomach called parietal cells. Those cells can be encouraged to produce more acid by the presence of histamine. Histamine found in foods can actually upregulate the amount of acid that's being produced in the stomach. That increased acid can then lead to increased irritation in the esophagus. And you find that a lot of the food triggers that need to be eliminated when you have acid reflux are commonly high histamine foods. This is only going to happen, though, if the acid can get through that lower esophageal sphincter into the esophagus. We said that the lower esophageal sphincter allows food to get in, and it's supposed to prevent things from going back up. So it's a one-way valve that allows things to flow in one direction. Mechanical problems like hiatal hernia is a process where if this is the lower esophageal sphincter, part of the stomach actually presses up against that and can cause, when it's closing, to be a little more flimsy and actually not close properly. Now, something like that can be surgically repaired in cases where it's really causing a lot of severe problems. That's not really the majority of cases that have acid reflux have hiatal hernia. Another problem that can happen is the lower esophageal sphincter is more susceptible to pressure and is just not closing the way that it should due to the pressure that is in the stomach. So there's pressure here below, and it's pushing up against that lower esophageal sphincter. This typically, issues like bacterial and fungal overgrowth can cause gas that increase the pressure in the stomach, which can push up against that lower esophageal sphincter and cause it to open up in the wrong direction. These types of problems are usually thought to occur more in the small intestine than in the stomach, but I've definitely seen cases of treating bacterial and fungal overgrowth have their acid reflux symptoms resolve after treatment. Another cause for increased pressure in the stomach is when there's lack of enzymes in the stomach. There can be increased peristalsis because the lack of acid is not breaking down the food properly. And so by taking digestive enzymes or taking acid like apple cider vinegar or something like lemon juice, that acid, the acetic acid that's in there, can actually help activate some of the enzymes that are present in the stomach already, and then you get a more even breakdown of the food and not as much of the mechanical peristalsis is needed, so there's less pressure on that lower esophageal sphincter, causing the acid to go in the wrong direction. So these are some of the common triggers, common things that I see in my practice for causing acid reflux. Hiatal hernia, of course, histamine intolerance or excess histamine, decreased acid or enzymes, and also like infectious problems. Again, those are the most common reasons that I find as triggers for acid reflux. Of course, the most common conventional approach is to say there's too much acid in general and to give you an acid blocker, either short-term or long-term. And that's certainly necessary in some cases, but the vast majority do not and should not take acid blockers over the long term. You can check out my other video on reasons not to take acid blockers, or go into more detail on some of the negative consequences of that. If you are taking an acid blocker, make sure you check with your doctor before you discontinue it. There are some very good reasons to take acid blockers, even long term. Okay, that should do it for this video on what triggers acid reflux. So those are the most common triggers that I see in my practice. I'd be curious to know if you've noticed any other things that trigger your acid reflux. If so, drop it in the comment section. If you have comments or questions about anything in this video, also drop that in the comment section. Thank you again for watching. We'll see you next time.